Following ptosis surgery, how long before you are able to open that eye wide? I had ptosis surgery 3 weeks ago, the type done on the inside of the eyelid. The results have been the ptosis is worse than before. I have experienced some double vision, and I am unable to open that eye wide as I can on my other eye. Is this temporary? I had my follow-up appointment with the surgeon, and he said that with this type of surgery, the lid usually raises in the first 2 weeks. He has me scheduled to come back in 4 weeks to check the progress.
Thank you for your question. In your question, you stated you had ptosis surgery approximately 3 weeks prior, and that apparently the eyelid level has gotten worse. And there's an issue with the timing of your follow-up in terms of the length of time between now and when you're going to be seen again. Well, I think that it's critically important that you do contact your doctor's office to advise them that your ptosis has actually gotten worse. You see, after eyelid surgery, and ptosis surgery in itself has its own unique challenges. We're dealing with a muscle called the levator muscle. And when you're talking about a posterior approach, or behind the eyelid, there are a couple of different procedures that are applied to that, including what's called Mueller's muscle resection or posterior levator resection, as well as Fasanella-Servat. Now, these are names that are technical, but if somebody first is concerned about their eyelid height, it's usually associated with some degree of swelling. The physical weight of swelling on the eyelid can push the eyelid down, as well as the healing process of the muscle and all of the other related issues that occur, especially in the first 1 to 2 weeks after surgery. From your photo, it doesn't look like you're very swollen. So it means that with that factor being eliminated, there may be an issue with the connection or the way the tissue is supposed to heal. It might have been that some stitches may have broken, or might have been some separation. But I think that your surgeon should at least be informed. The timing of any revision surgery may be dependent on when your surgeon is informed. I'll tell you, in my own practice, if such a thing were to happen, I would prefer to find out sooner rather than later. It's a balance of when you want to operate regarding the degree of swelling and healing and what kind of impact there is on the eyelid height. When there is a real separation, before the tissue has a chance to develop scar tissue, there's often a window of opportunity. And it's not necessarily within a few days or a couple of weeks. You actually have some time. But again, it's a matter of what your surgeon's preference is. So I think that you should insist to have your surgeon see you sooner. I mean, that would be my advice in terms of how I tell my patients that if there's any questions or concerns, I'll tell my patients that I'd rather see them than guess how they look. Even if they send photos or pictures with their phone or have someone else take a picture with a camera, it's always better to see the patient in front of you. And considering that you had your surgery so recently, I think that'll be the best thing for you, is to meet with your doctor sooner rather than later, get an understanding of what's going on and what the appropriate next step is. So I hope that was helpful. I wish you the best of luck. Thank you for your question.